Addiction is a disease. There's plenty of debate out there as to why and how addiction to drugs and alcohol can be considered a disease. Some argue that it's not something you can catch, like a cold or the flu, and that calling it a disease is an excuse. One YouTuber calls out the disease debate into question and defends his point by insisting that choice is the main factor when it comes to addiction. Choice can certainly be a factor, but that doesn't dig deep enough when considering the serious problem of addiction. I think it's best to first look at what is considered a disease in the first place. We asked Dr. Tom Daub, the Chief Clinical Officer and Chief Compliance Officer for American Addiction Centers, what is a disease?
So a disease, the American Medical Association looks at a few factors when thinking about what actually constitutes a disease. First, it's really about looking at something that's wrong with the body, some dysfunction of the body. Second, that dysfunction has to have certain signs and symptoms that are consistent that define the disease. And third, it really has to cause harm to the body in some way. So that's really why we think of addiction, like other kinds of illnesses, as being a disease. It comes from the body, it has consistent signs and symptoms, and it causes harm.
How long has addiction been considered a disease?
What we know about addiction today is very different than what we knew about addiction many, many years ago. Many years ago, we thought about addiction as a character flaw or a weakness, that if somebody was just strong enough or good enough, they could overcome. And what we now understand about addiction, much of this based on research that's been around for well over 20 years, from brain imaging, genetics, is we understand that addiction is a disease of the reward circuit in the brain, to where people with the disease of addiction have a disproportionate response or a different response to drugs than people who do not have addiction, making them much more likely to get hooked on these drugs and much more likely to get damaged in terms of the consequences in their lives, which is why some people can try a drug and not experience consequences, negative consequences, and why other people take it and it really destroys their life.
Are people born with the disease of addiction?
We think that many people are born with a propensity to addiction. It really has to do, as I said earlier, it's the reward circuit in your brain. It's the very primitive part of your brain, the middle of your brain, there's this reward circuit that tells you, when something good happens, it sends you a signal that was good and we want more of it. So there's a dysfunction in that circuit to where if you are taking a substance, it gives you a very powerful response and will drive even more of that behavior. And even more so, it'll essentially take over even the conscious part of your brain that would normally have control over that behavior and some of the negative consequences. So essentially, it's a very primitive part of your brain that doesn't work quite right and can take over essentially the rest of your brain.
So what do you say to someone arguing that they can't catch addiction like the flu or a cold?
Some illnesses are communicable, like the cold or the flu. You catch them from other people. We understand there are bacteria or viruses that cause those. Addiction is not like that. It's much more like other mental illnesses like a depression, bipolar disorder, other things that really represent a brain dysfunction. There are lots of reasons why those things occur. Some of it may be based on your genetic characteristics, that you may be born with certain risks if you came from a family where addiction was prevalent. Some of it may just be a genetic quirk of fate that makes you more susceptible to addiction, or something else that's going on that we may not completely understand that's affecting this part of your brain. One of the mistakes I think that we made years back when we thought about addiction is that we looked at the consequences of addiction, the fact that you could have increasing dependence on a drug or withdrawal symptoms as defining the addiction, when really what defines the addiction is this dysfunction in the circuitry of your brain. And the fact that you're dependent on the drug or experience withdrawal is just a secondary consequence of the disease that you have of addiction.
Is it possible to cure the disease of addiction?
That's a great question. I think it's possible that someday we actually can cure the disease of addiction, just like many other diseases. Today, I think the best treatments that we have are certainly medication that can help addiction, and there's lots of therapies that can help addiction. Just like if you work with depression, you can go and talk to a therapist and get assistance that helps you deal with your depression at the same time that you may also take medication. Those decisions, the right decision, is really based on the individual needs of the patient and should be determined in consultation with the doctor, the care provider.
What should someone do if they think they're addicted to drugs or alcohol?
Seek help. There's a lot that can be done for people with addiction these days, for people dealing with it. There's a lot of external support. There are a lot of people who have recovered successfully. Even though you may not feel that there's hope for you, there's absolutely hope. There are so many stories of positive stories of recovery where people have been able to recover their lives from very, very difficult, desperate circumstances, help is available. There are all kinds of support groups in the community, Alcoholics Anonymous, other support groups, and treatment options available to help.
So we can clearly say addiction is a disease, correct?
I think there's no question among the scientific community and the professional community that addiction is a disease. I think the mistake where people often start to think about addiction differently is they look at circumstances. You know, I've got my Uncle Stu who drank alcohol every day for 20 years and then he just decided to quit. And because Uncle Stu was able to quit, that proves that addiction is not a disease. You know, what that proves is Uncle Stu probably didn't have the dysregulation in his brain that somebody with addiction has that drives them to drink. He probably wasn't truly an addict in the first place, even though he probably was to some degree dependent on the alcohol, may have experienced problems in his life, may have experienced withdrawal. But he probably, his brain, the reward circuit in his brain probably wasn't dysfunctional as it often is in people who really truly suffer from addiction. It makes it so hard for them to recover from the drugs that they're using.
Thank you, Dr. Daub, for your expert and professional insight on this heavily debated topic. We hope this was helpful. Please feel free to comment and let us know what you think. Feel free to share this video, like it, and subscribe too. Thanks for watching.